our study was basically a subset of patients treated on the 2204 trial, which was a trial of BGJ398 or infigratinib as second or subsequent line therapy for cholangiocarcinoma with FGFR2 fusions. So we had presented the analysis of this study last year at ESMO meeting, where the 71 patients had been enrolled and treated with infigratinib 125 milligrams daily, 3 weeks on, 1 week off. And we had reported that the progression-free survival in this subgroup was a little over 6 months, and the response rate was close to 30%. What is not known, however, is what is the outcome of patients with FGFR2 fusions with standard chemotherapy. So therefore, we looked at our study and evaluated a little less than 50% of patients who had received infigratinib as third or later line of therapy, and looked at the outcomes of these patients with standard chemotherapy when given in the second line. So as you know, second line chemotherapy generally is FOLFOX or gemcitabine-based combinations or capecitabine. And we retrospectively evaluated about 37 patients who received chemotherapy, and then looked at the outcome of these same patients when they received third or later line infigratinib. So we found that patients who received second-line therapy with second-line standard chemotherapy had a response rate of only about 5%, and their progression-free survival was about 4 months, which is sort of the survival that you get and a response rate that you get with chemotherapy with FOLFOX, such as in the ABC06 trial. On the other hand, the same patients, when they received third or subsequent line infigratinib therapy, the response rate was much higher, over 20%, and the progression-free survival was over 6 months. So this retrospective analysis indicated that the outcome of patients with FGFR2 fusion with standard chemotherapy in second-line chemotherapy, in the second-line setting, is quite dismal and is no better than the FGFR2 wild-type counterparts. These patients will potentially be benefited more with FGFR-directed therapy, such as with infigratinib.